Welcome everyone. And thank you for joining us today. Thank you, Phil. We're so excited to welcome Phil Sharif for today's workshop. Um, Phil brings a uniquely broad perspective to this discussion. After studying physics in Oxford, he spent 7 years in British Army, followed by 2 decades working as both a British and Australian diplomat across Latin America, the Balkans, Asia and South Asia, and the Pacific. And in recent years, he has focused on the evaluation of global cybersecurity capacity building, or CCB, programs as part of his PhD study at Royal Holloway University, London. Because of that background, I think today's discussion has the potential to be, to go beyond just the technical framework alone. But I am also very interested in hearing Phil's perspective on the broader conversation happening across the CCB community and maybe international development community and diplomat circle around the question like what kind of metrics and measurement are increasingly being used, or how do we move beyond activity reporting towards meaningful evaluation of the cyber capacity building. One aspect of Phil's work that is especially interesting to this group, to us, is the focus of behavioral change as part of the evaluating cybersecurity capacity building interventions. Within the CPH community, cyber public health community, we've been discussing how to move beyond simply measuring outputs and activities, and instead ask a deeper question: did the intervention actually change people's behavior? And one of the evaluation perspective Phil explores connects closely with the CBM, the cyber belief model, a newer model developed by Adam and inspired by the health belief model from public health. So we're especially looking forward to hearing Phil's thoughts on how these behavioral concepts can be operationalized and evaluated in the real-world CCP programs and scalable approaches to impact assessment. With that, Phil, thank you again for joining us today. We're very much looking forward to the discussion. We're going to have maybe 20-30 minutes of your talk and have the discussion and question and answer time after that. And we close the workshop at 1 o'clock p.m. for Eastern. With that, over to you, Phil. Thank you.
Thank you very much, and thank you for the kind invitation to talk about the work that I've been doing. I won't labour the introduction. Yuri's done a much better job than I could do of introducing myself. So I will give a brief introduction to what this project is about and why I'm doing it, and then it'll be a quick run through of some of the sort of the theory and some of the practical aspects. And then I think most importantly for this group, the focus is on national CSIRTs. But what I want to try and do is show how integrating the CyberGreen cyber belief model into impact evaluation can actually be really transformative in the way that we conceptualize what capacity building is and what we're trying to achieve through it. And also I want to try and get to the sort of the big question is why bother? Why do we do this evaluation? I think I'll presage that with an observation of some of the other talks that have happened through CyberGreen. In particular, Professor Michael Hicks, I really enjoyed his presentation. He was talking about cyber harm and how you can measure that. And one thing that really struck home to me was he said, you've got to join the dots. You've got to see what you're doing, and you've got to be able to join the dots between what you do and that potential idealized reduction in cyber harm. And what I'm trying to do is I'm trying to join the dots, but I'm starting not at that sort of macro level cyber harm reduction. I'm starting at what we actually do and try and join the dots the other way around. I think he was coming at it from the sort of top down. This is very much from the bottom up, looking at the types of work that we do, how we can combine those different interventions, how we can compare them meaningfully, how we can gather data, what theoretical lenses we're using to do that comparison, and then come to an evidence-based conclusion about where we're best to spend our resources. Everyone's probably seen one of these before. There's a very standard program theory, input, output, outcome, impact model. And I don't know about other people on the call, but I've certainly spent a lot of time arguing the difference between an outcome and an output and an impact. And we waste a lot of time on that, to be honest, and we can be overly pedantic. And actually, it doesn't really get us to where we want to be. So about 10 years ago, the behavioural scientists created a different type of theory of change model, which is based more on the behavior that you're trying to change and how you can track that through. And if I just narrow down to a slightly more useful slide, if you look at it through the means of what we do, which are the activities and the outputs, who we're trying to do it with, what behavior change we're trying to initiate, and the different subcomponents that we need to change in order to have behavior change. What are those benefits, and what's the sort of long-term impact of those benefits? But what I particularly like about this model is it really talks about the external influences, and these are really, really important. And often in the previous models of outcomes and impacts, we kind of miss those external influences. We focused on assumptions and supporting activities, but those external influences are really key to understanding how we change behavior and how we then measure it. So what I started off with was in my project looking at lots of different types of interventions. I went through a database of about 1,000 different activities that we're doing capacity building, and you can disaggregate into 11 different types of activities that we do, all the way from donation and provision of digital equipment through implementing strategy, training and education, exercising, all the way through to conferences and sort of mentorships. These are the ways in which we use our precious resources to change behavior. If you're looking at something like an incident response team, maybe at that national level, you can narrow it down a little bit more usefully to maybe 5 different types of interventions. And this has been the basis for the work that I've done, narrowing down to a more meaningful or more useful subset that we can then interrogate more accurately. We look at who we're trying to do it with. If you're looking at an incident response team, it can be anything from the ministers and the government policymakers and budget holders, through to the incident response team managers and technical staff, all the way through to the constituency, the network owners, the people that we're trying to help make their systems more secure. We can then look at different interventions for different people. Drafting and implementation of strategy usually goes at that higher level. Maybe exercises at that constituency level. So it's not all interventions for all people. We have to narrow it down a little bit. And then this is where behavioural science becomes really important and comes to the fore. What are we trying to change and how are we going to change it? For that, we look at criminology, and criminology breaks behaviour down into 3 different subcomponents. You need to have capability, you need to have opportunity, and you need to have motivation. And a really simple way of breaking this down is if you want to go and rob a bank. The capability, well, you need a gun, and you need to be physically strong, and you need to have a getaway vehicle, you need those sort of physical, and you need to know how to rob a bank. You need to be in an environment where you can rob a bank, so you need to be near a bank. The doors need to be open, the safe needs to be open. So that's your opportunity. And you need to be motivated. Maybe it's the financial aspect or the thrill. So you've got 3 different components that are required to go and rob a bank. You need the capability, the opportunity, and motivation. And it's no different in capacity building. You need to be able to do something. You need to have an environment in which you can do that, and you need to be motivated to do it. And a really simple example of that is if we look at the donation of physical equipment. So we donate a bunch of servers or a bunch of software. That's a capability change. That's an opportunity. We are enabling people to work through the donation of kit. But we know it's not enough. You need to be able to use that kit. And this is where the capability comes in. You need to have some psychological aspect to your capability. You need to be trained to use the kit. But we know that's not enough. You need to be motivated to use that kit. You need to have a desire to use it. And that could come from policy, it could come from leadership, it could come from a cultural change. There's lots of reasons why we might want to use that kit better. Some interventions have all 3 of them. Like an exercise might have both the psychological, might have the opportunity from a an environment or a social perspective, and there might be behavioural changes from a motivational side. So you might be pressured into doing, you might have sort of peer pressure, you might again have strong leadership, you might have a cultural shift. Is that recording? There you go. So those motivational opportunity and capability changes then lead to a behavior change that lead to a direct benefit. So that's what you do as a result of your training, as a result of the intervention, and the benefits that accrue from it. And then the final step is those longer term impacts. And I'll just very quickly step through what that looks like from an incident response team at that national level. If we look at the outputs and activities, we need models to be able to grade ourselves against. Unfortunately, in incident response, we've got a couple of really good models. You've got the OpenCert Sim3 model, and that is disaggregating the different subcomponents of an incident response team that are required to be present for an incident response team to work well. And if you look at these, they really nicely translate into the activities and the outputs from that first part of your theory of change. So if you look at something like education and training, which is part of your intervention, maybe we're looking at different types of training. And if we focus on something like soft skills, the Sim3 defines what soft skills are and how we can measure against it. So that's great. We've already got a model that says, this is your output and activity. This is how we can grade against it. Easy. We know who we're trying to reach because, again, if you look at all the different interventions, they nicely articulate who the different actors are in this space. And if you're looking at soft skills training, maybe you're looking at the CSER managers and the technical staff. And then we look at what are those capacity changes? What are we trying to change and how are we going to do it? So if you look at training, there's a capability aspect of training. It might be communication technique, it might be stakeholder engagement, it might be a physical capability like delivery or other types of physical capabilities. We enable people to do training better. So to be trained better. There's an opportunity one. Maybe we're giving the time and a budget and the mentoring and peer learning that will again help people with those soft skills. And there's clear motivation things. It might be leadership. It might be some form of cultural shift that motivates people to use those soft skills better. What behavior change are we trying to do as a result of that? Well, this is where we look at a different model. This is where we look at the first service delivery model. And the first service delivery model articulates very nicely different services that an incident response team is supposed to do. And if you look at the behavior change that we're trying to enable through soft skills training, you can look at that from knowledge and transfer and situational awareness, where we say there are maybe 4 different aspects that can be where behavior change from soft skills training can be beneficial. And let's just take one of those. Let's take communication. Okay, we train people better at communicating. One of the functions in first is internal and external communication. How do we know we're better at it? Because it gives us the outcomes of better internal and external communication. And that's really great. So we've already got 2 industry models that we can plug into this useful theory of change, and it will tell us what we're expecting and also how we can grade it. So this is great. My job's very easy. What we don't really get at the end of this is those longer term sustained impacts, because it's not quite there yet. We're better. Oh, sorry, Adam.
Hey, Phil, could you just go back to the direct benefits thing? There was a lot there. I wanted to read it more carefully.
Oh, sure.
I will just steal a screenshot so that you can go on and I can read in the background. Thank you.
Yeah. So all of these, if you go onto the first service delivery model, there's a huge document of over 100 pages, and each one. This is just shamelessly plagiarized from their work. So all I'm doing is plugging in different models to this sort of theoretical framework. So the direct benefits are we're better at information sharing. But that doesn't really lead us to where we want to get to. To do that, you've got to sort of hoop back to another sort of loop through these behavior changes, because we need to do more iterations of this to get through to where we want to get to. So if you look at these are the outcomes, these are the direct benefits of your soft skills training. Those can actually be seen as outputs and activities for a second round of behavior changes. So that better information sharing might now involve the technical staff and the constituency. So we're better at disseminating information. How do we know that we're doing it better? Well, again, we look at the first framework and it says, well, there's 2 different ways of seeing if we're better at information sharing. And it tells us about report acceptance on both sides, on both the team side from taking information from the constituency and the constituency side taking information from the team. And that looks like this. And these, again, Adam, just so you know, these are part of the first service delivery framework. These are outputs and outcomes that they have discerned as part of the functions that they're trying to deliver. Does that, the final thing is, these aren't just straight logical loops. They have feedback mechanisms. And this is really important when we look at the underlying reasons why things happen. If you do, the more information sharing you have, the better you get at it. Why is that? Well, because you're building trust, and trust is fundamental to a lot of these behavioral changes. So we need to put feedback mechanisms in that says, well, if we do this, we get better at it. So it's not just a linear process; it feeds back onto itself as well. And this is why the useful theory change is a much better framework to consider this through, because your standard input, output, outcome, impact doesn't really allow for this in the way that the useful theory change does. So does that get us to those final high-level societal benefits? Not really. You've got to keep iterating through. And what you find is you do soft skills training, maybe you get better at information sharing, then your incident detection process is better, and eventually you can see that you are better at detection, remediation, and your systems are safer. And that's where we want to get to. But you can see the loops that you have to jump through to get there. But importantly, when we get there, if you look at each of those lines, it gives us different ways of disaggregating and joining those dots that Michael Hicks talked about. So we can join the dots from our soft skills training through our behavior change, through our first service delivery model, and we do that through information exchange, then we do that through better detection. And eventually what we can do is build up a table of different components from the SIM3, the behavioral change wheel, and from the first service delivery model. And you iterate through and you get to better mitigation and recovery, reduced harm, all the way at the end. And it tells us how we got there. Now, one of the limitations is obviously soft skills training isn't the only thing we do. We can do technical training. We can give them an incident tracking system. We need to do strategy, mandate, authority, responsibility. There's lots of different interventions that we need to be looking at to have that overarching effect. And these happen at different points in time as well. So that's really important. So it's not just at the start. Maybe the incident tracking system comes in halfway through. We're defining our mandate and authority at some point in this process. Maybe looking at specific incident processes towards the end. So we plug this model in at different points. And it gives you a means of comparing, saying, well, this is what we got from soft skills training. This is what we got from technical training. This is what we got from exercising. And you can go on and on. Obviously, technical training will have different outputs at that start level. So when you look at something like this, if you put all the different types of interventions, all the different changes together, you get what I would call a horrific table. But I'm putting on there just to show that this is the level of detail we can go into. Down the left-hand side are all those different measurement points. And across the right, where it's blue, that says that that measurement point is relevant for that type of intervention, be it soft skills training, be it technical training, be it exercise, and you can go on to strategy, mandate, policy, all the way through to technical equipment provision. And so you get this huge table. And then we need to look at what are the data sources that each one of those columns can be fed with, because data is a really important part of this. And we can discern different types of data that help at different points in this process, from documentation to feedback, to telemetry, to training and assessment. And what I think is really important on this is where we focus a lot of effort is on training and test results and assessments. As you can see down the side, we've got time. To get to mitigation and recovery improvement takes a lot of time, takes a lot of effort, takes a lot of different types of interventions. What we're not very good is joining those dots to get there. What we're very good at saying is we've done a bunch of training, we've done some assessments, but if you can see from this diagram, the usefulness of those assessments stops quite soon, and there's a whole other chain of events and chain of behavior that has to occur to get to that desired end state. And at the moment, when we just look at training results, you can see how incomplete that model is. And the model's incomplete for another reason. And this is really important. All my interviews, all my observations have said that one underpinning thing for incident response team is trust. Okay, we know that we need to have trust between response teams and constituencies and in that broader ecosystem. But where are we measuring trust? How is trust articulated in this framework? And I get to it is slightly, but it's not obvious, and it takes different types of measurements. So why is that? What are we getting wrong here? Why is this model incomplete? And this is a path as a technical person with no philosophical background whatsoever. This is a path I never thought I'd go down, but actually in doing this and looking at different models, what you realize is actually different ways of viewing reality are really important when we look at evaluation. And this leads on to a really interesting amalgamation of the cyber belief model. You have this thing called the critical realist, different layers of reality. And honestly, I never thought I'd hear myself say those words, but the more I've looked at this, the more interesting it is and the more relevant it is if we really want to do evaluation properly and not just have it as this performative thing that gives us a few indicators and we're all happy and can go in, please our donors. It breaks reality down to three different layers. The empirical layer is what we measure. It's what we can directly observe, what we see when we try and do evaluation at the moment. And it's indicators, metrics, surveys, incident reports, communication, performance reports, all the stuff that we throw at these interventions to say, are we doing a good job or not? And as you can see from the cliched iceberg, that's quite limited. What we actually do is the next level down. What are those behaviors? How do we interact with people? What are we actually doing? But that is also quite incomplete. It's harder to measure, but you can see it, so you can observe it. But it's still a bit harder than that empirical level. What we really want to understand and change is the 70% that underlies this. What are those? What forms those behaviors? Why is it that certain behaviors happen within certain structures, within certain contexts, and they don't happen in other contexts and in other structures? What's the power dynamic? What's the culture? What are the norms? What are the systems and institutions that change our behaviors at the actual level that we then measure at that very superficial empirical level? And a really good example of that is in education. So if you look at education, if you're doing an education intervention, that empirical level may be test results. It may be that the pupil scores increase. It may be that teachers report they're more confident, and maybe observers notice that classes are run better. That's your empirical level. What's actually happening is the teachers may be prepared better for lessons. It may be that classroom interactions have improved and the students are more engaged. That's what's actually happening. But why is that? What mechanisms have changed to create that behavior change? What are those sort of underlying causal mechanisms and structures? It may be that the teachers' knowledge and self-efficacy has improved. It may be their sense of agency and responsibility has improved. Maybe there's stronger leadership. Maybe there's been a significant cultural shift. Maybe there's a curriculum alignment. There's lots of different things that have led to those actual layer behavior changes. And when we try and transpose that onto cybersecurity capacity building, if we look at something like information sharing, at that empirical level, you're looking at things like number of reports shared. Are the reports faster? Are they more accurate? Is there higher participation in information sharing? What are the survey reports saying? That's that empirical level. What's actually happening is communication is happening more frequently. We've got standardized practices and technical processes in place. There's a behavior change that's happened that has enabled us to share information more effectively and have it received better. But what's actually happening? Well, maybe the capability of the operators improved. Maybe they're better at drafting and disseminating reports. Maybe there's greater confidence in the reporting. Maybe there's greater trust between the two parties involved in that information sharing. Maybe structurally we have frameworks and we have incentives and we have legal protections. So the reasons why information is shared better sit at that real level. And I would argue that whilst we can count the number of reports, we're not very good at looking at that sort of context and structure and mechanisms component that is the driving change at that actual level that we observe at that empirical level. And I think this is demonstrated by looking at how at the moment we measure and evaluate. We look at that empirical level. We maybe look at CSIRT documents, maybe look at test results, maybe look at management feedback. But at that actual level, this is where we're looking at information processes are in place, SOPs are established, communication happens, and and report acceptance has improved. So we can do it. We just don't recognize where we should do it and what we're actually observing. But what's really important is what's happening at that real level. And when I talked about trust, you can kind of see trust through some of these indicators. The constituency needs are understood. Well, that means you're interacting better with them. That means they're opening up to you and they're telling you stuff. So trust does exist in these measurements, but you've really got to dig deep to find it. And if you use this sort of sense of reality, these different layers, we then look at how realist evaluation happens. And realist evaluation is one of these different mechanisms that's relatively new. And rather than look at a sort of constructionist approach to evaluation or a very much pragmatic approach to evaluation, this way of evaluating looks at what the underlying reasons why things happen are, and what the triggers for behavior changes are, and what the outcomes of those are. So it might be your context is you have strong leadership, but you don't have resources, which means that maybe resources are the things that will then trigger those mechanism changes. And that's different from where you have weak leadership but loads of resources. That same intervention wouldn't work because the context within which you do it is different. So understanding the context can help you. It's a bit like a training needs analysis, but it's a bit more in depth and a bit more sort of cultural rather than practical. But it allows you to understand what mechanisms you're trying to trigger in people and what behavior changes you're trying to identify. And when you sort of bung all this together, if you look at a critical realist view and a realist from a realist evaluation framework, you can see where that context and those mechanisms sit at that much deeper layer where we're really understanding what it is we're trying to do, who we're trying to do it with, and what mechanisms we're trying to create that will then enable behavior change. And this is where I come onto the cyber belief model, because I think this belief model integrates beautifully into the behavior changes that we talk about when we look at those mechanisms. And Adam, I won't do justice to a description, so please jump in if I'm doing a terrible job. But in very broad overview.
Phil, just let me say, one of the exciting things about doing research is that other people pick it up and interpret it, and so you are going to do more justice to this and more honor to me by actually using it than I ever could. So I am excited and grateful, whatever you say.
Well, do tell me if I'm also wrong. But for the cyber belief model, again, very, very superficially, and Adam's done a great talk on this that's recorded, so you can refer back to that for a much more in-depth discussion about it. If you start with individual perceptions, people perceive susceptibility, perceive seriousness of a problem, and those beliefs, perceptions are modified by psychosocial factors, and those can be demographic, they can be organizational, they can be cultural, and those sort of modify our perceptions of the problem. They also modify perceptions of the threat, and that amalgamates to a sort of a more rounded perception. And then you have cues. You have things that make that perception turn into a behavior, and that can be anything from mass media to threat intelligence to advice from a friend, and those amalgamate into a perceived benefit versus a perceived barrier, and all that aggregates to a likelihood of an action taking place or not. And that's my very, very brief sort of overview. Do you want to add anything to that? Cool. Thank you. Obviously, there's a much more in-depth discussion of that in previous workshops. So when we look at how we're trying to change behavior, you can map those capability, opportunity, and motivational components onto the cyber belief model, where things like perception is a capability. It's a psychological sort of capability. It's about your knowledge and your theory and how you process things. There's an opportunity, both physical and social, and that's your psychosocial modifying factors. The environment in which you're in changes your perception and therefore integrates with your capability. And then those cues to action are your motivation. What's increasing your motivation to do something about it? And that all aggregates to a behavior change. So very much the combi model and the threat belief model, I think, talk about the same thing in slightly different ways, but usefully, They also talk about it in a way that a critical realist would understand from a context and mechanism perspective, and also a realist evaluation person would understand from those contexts and mechanisms. So they all aggregate into something that I think is really useful. If you look at it through a conceptual model to start with, and then I'll come on to how we integrate that at those levels of reality, you have cyber belief constructs, you have perceptions, perceived severity, likelihood, and then you have self-efficacy, you have perceived action effectiveness. And this is where it's important. You have trust. Trust is really important, and it identifies that. And then you have norms, responsibility, environmental cues. These are your constructs, and these integrate and sort of operate within those combi model behavior changes to an overarching likelihood of behavior change. And this gives us a much better understanding of why behaviors change and what we can do from an intervention perspective to help push it in the right direction. And if you put it all together, I've done this horrible diagram. Please take it away, screenshot it, and look at it and critique it. But the way that I see this happening is these contexts and structures and mechanisms and behavior changes all happen at that hidden layer. This is what we're really bad at observing at the moment. But those behavior changes then pop up into the actual layer. That's where behaviors really happen and things happen, whether we're observing them or not. And then at the top layer, we decide what measures we take to then observe those behavior changes. So again, it gives us a much richer picture of why stuff happens, how it appears in the real world, and then the limitations of the measurements that we do at the moment. Another one, we'll put those interventions because those interventions feed into that bottom layer in a way that we're starting to understand a bit more thoroughly. And these models help us do that. I'll just take 5 minutes to talk about why we bother, because I thought that was important. And I think the important thing about why we bother isn't just this sort of idea that we want to evidence-base what we do because it's a better use of resources. I think that's a really laudable, achievable aim. And I think it's really important to say that. But I don't think it's the only reason we do it. And I think we can look at lots of different policy areas, but it's now coming into capacity building, and I'm glad it is. This discussion about why metrics are a risk as well as a benefit. And this came out last month. Could your choice of metrics be harming your SOC? And this talks to this idea that bad metrics or poorly defined metrics change behavior. And if you can look at all sorts of different policy areas, there's studies that show that metricing ambulance response times on their times causes more ambulance crashes. Not good for patient care, but it makes your stats look good. And this is all something that's called Goodhart's law. When a measure becomes a target, it ceases to be a good measure. And this is the law of unintended consequences or perverse incentives. And you can see it through, you measure something, you optimize it, but it distorts your behavior and it degrades what you're actually trying to achieve. And this is sort of a nice way of putting it. So what we measure turns into what we do. And if you do that, it's risky. And there's even a phrase for it. And people might know about the McNamara trap. This is back in the 1970s when Robert McNamara was Secretary of Defense. He tried to datafy war, and he created a bunch of data points. The main one was body count. And there's a number of enemy combatants killed. And that was how he would metric whether the war was going the right direction or not. Missing the whole point of actually security is not about the number of enemy combatants you kill. It's about something much broader. But he decided to do that. And there are very clear behavioral changes that came with that demonstrate that this was a very poor measure, perversely incentivized lots of, quite frankly, bad stuff to happen in the Vietnam War. More recent example, this is a survey done of call center managers. They were told to talk about what metrics they thought would be most useful to see if they were doing a good job. And they came up with 10. And the first 4, if you amalgamate the first 4 to the first contact resolution, customer satisfaction, average speed to answer, and abandonment rate, you merge those into some kind of qualified assessment of a bunch of quantitative measures, you get a good idea if your service center is doing a great job. Unfortunately, this is what we actually use in service centers, average handle time. And what this does is it incentivizes rush calls, unresolved issues, more repeat calls, and overall poorer experience. So we can see how metricing to a poor data set causes bad behaviors. And that's a risk that we run if we get this wrong. And I think that's really important. Another area that we can look at, another policy area, there's been lots of reports done on the intelligence services in the US post 9/11, weapons of mass destruction. And they came up with one of the issues was the way that we grade intelligence analysts. And it was focusing on the accuracy of their reports. And what they found was focusing on the accuracy of reports led to bad behavior. It led to biasing towards safe views, penalizes honesty. And so what they suggested and what they then implemented was a way of not grading on the product, grade on the process. And when you look at this, you grade on how you do your job. The assumption being that if you do the job in a specific way, you're going to be right more often than you're not. In intelligence, you're trying to sort of second guess human behavior. And you can be wrong for the right reasons and you can be right for the wrong reasons. So basing it on accuracy is a poor measure. Basing it on process, and actually if you look at this process, you look at the language of the process, there's a lot of language of behavior here rather than language of outputs. And that's really helpful. And I think we can merge that. So if you merge that into looking at an incident response team, rather than saying, are we detecting quicker? Are we containing it quicker? Because that can lead to perverse behaviors where we might say we've detected it, or we might say we've resolved it and we haven't, or maybe we avoid the big stuff, or maybe, and there's lots of external factors why those figures change. Rather than that, look at the process through which you go through and grade on that. So it's trying to learn from different policy areas what is good evaluation, what isn't good evaluation. Final one, and then I'll be quiet, and I promise this is the last one. I love this. So when you look at metricing, it's not that there aren't good data sets, it's just that we often pick the wrong ones. And on the left is this Robert McNamara, number of enemy dead. There was a study done in Afghanistan at the height of the insurgency, and they suggested what I think is an absolutely brilliant metric. They suggested the price of non-local fruit and veg. And if you think about it, what do you need if you're in Kabul to get a tomato from maybe Southern Helmand? And I'm making up the type of fruit and veg. If you're trying to transport something from Southern Helmand to Kabul, what do you need? Well, you need roads that you're not going to get attacked on. You need drivers who are willing to drive. You need fuel. You need vehicles. You need an overall sense of security that means people feel that they are safe in transporting stuff from A to B. Now, there's lots of external factors, maybe that there's been a drought, or maybe the price of seeds have gone up. Maybe the price of gasoline has gone up for a totally different reason. But if you control for those different types of factors, actually, the price of non-local produce isn't a bad proxy for security. I thought that was really good. So I'm entitling the final part of my PhD, the search for cyber tomatoes. What is a cyber tomato? What metric haven't we discovered yet that will give us that overarching sense of an amalgamation of proxies that we can say, this means we're getting better at it. And this comes back to the Michael Hicks point. You know, how do we discern we are reducing cyber harms? How do we do that? And importantly, what model do we use to join the dots from what we do to those overarching sort of cyber tomatoes reducing in price? There you go. I will now be quiet. That is me. Thank you for your time. And please, any questions, just fire away.
Thank you so much, Phil. That was fascinating. Adam is ready to jump in, so go ahead.
No, go ahead, Yuri.
No, please.
So this is more a comment, but the thing I really appreciated is when I saw your direct benefits at the beginning, I was looking for a direct benefit of the form reduced breach rates. And I really like the way you sub-stepped that out to find your what you called at the end your tomatoes. And so I just wanted to echo and list that as an important takeaway, that those perhaps sometimes I grasp too high and thus miss instead of finding the achievable metrics. And so I really liked what you had done there, and I just wanted to comment on that.
Thank you. I say, when I started this project, that's what I was aiming for. But the more you scratch the surface, the more you look at the logics of change and how we change things, it's just not that easy. It's not that straightforward. There's so many externalities that we have to understand, and we have to understand why behavior changes happen. I was hoping it'd be that easy, but unfortunately, it wasn't.
Yeah, and I appreciate that you pointed out the bad metrics leads to bad, priority or bad behavior as an output. So, the any other questions, comments to Phil, Audrey?
It's half a comment, half a question. On your slides where you put the critical realist one,
Yeah,
at the very bottom, the 70% hidden, I
yeah.
think you put something like opportunity, and then you put time, and then another 3 or 4 words.
Let me.
Was time including workload? Because I know I'm not working in cybersecurity, I'm just an academic in law. But I found that so many mistakes are done when people are pressurized. And I'm sure it's translated in many other domain, but and that pressure, that workload, it's both a personal way of doing things, but it's also an institutional way. Was it what you meant by time?
Yeah, no. So the time is how interventions progress to those longer term benefits and impacts. But you're
Oh,
absolutely right.
sorry.
But no. But you're absolutely right to point that out. And it's sort of in there with your culture and your systems, your institutions, your goals, your priorities. It's kind of
Okay.
that concept of pressure, workload is sort of implicit. Maybe we should make it more explicit. It's a very good point. Maybe we should add that in. There was a really interesting study done on phishing rates in US healthcare institutions, and they did one of the very few randomized control trials that actually looked at behavior changes, and it did phishing rate before and then phishing rate after, and it also tried to correlate it with intentions. They did surveys as well. And they found no correlation between the click rate pre and post based on your change of intentions. The only thing they found that the phishing rate correlated with was workload, and which speaks to exactly that point that you make. It's about the pressure you're under, and this is where this real layer is really, really powerful because that is where the workload, the culture, the pressure, the norms really aggregate to someone who goes, I don't know what I'm doing. I just click OK. That's where that happens. And you can't see it at that top level. You can't see it because someone clicks on a link. You've really got to understand those deep-seated institutional issues to understand why they're clicking on the links and maybe why the interventions that actually take more people's time away from their workload aren't helpful because they just add to those time pressures. So maybe we just need to have a better way of integrating capacity building and a better way of understanding why people do it. And maybe there's a way that we can change behaviors, reducing the workload so they make good decisions. Maybe it's not about capacity building in the way that we think it is. And it comes back to that belief model. What modifies our perceptions? What modifies in that psychosocial modification of our perceived threats, susceptibility, and benefits that make us click on a link compared to not click on a link, which is why I really like the cyber belief model, because it explains it in that sort of cultural context, in that psychosocial context. And that's where that time pressure happens.
Yeah, I was wondering in that case if data breaches, the ones that are usually done by email, so not a hacking element, just the fact that you share the information with the wrong person, if that could not be looked through with your that model, because I'm sure there will be things underpinning that will be really important to understand, because in many institutions, of course, cyber attacks with ransomware and so on are, a major issue, but a lot of data breaches happen by just email, by
Yeah.
just sending it to the wrong people. And this people may not do it. Is that, if it is within the same institution, 9 times out of 10, it's not going to lead to anything. But it's still a data breach and it's still a bad practice. And it's just pure luck in a way that it didn't go to a person that would exploit it. So
Yeah,
that was
absolutely.
also, could you forward this to any government so that when they set up metrics, we don't get things that are just absolutely not useful and that do exactly what you describe, which is focusing on the top and actually leads to bad behavior changes, and it just makes things worse. Government need maybe a training in cybersecurity.
In my experience, and these are conversations I have with lots of donors. In my experience, it's an education that you have to walk them through why metrics aren't actually simple, why they're not straightforward, why having single metrics is actually dangerous. And you do get to the point where there's that understanding, but the problem is there's still a resource impediment because at that lower levels, these are hard things to measure. They're hard things to identify, and you have to be there for a long time. We're very bad at longitudinal studies. We're very good at, giving out certificates and saying we've done a great job and then leaving. It needs resources and it needs education and it needs understanding. And we're not there yet. But the good thing is we can learn off lots of different policy areas who have been through this iterative process of making mistakes. Health, education, policing. Anyone who's watched The Wire knows the mistakes that have been made. We're not blind to this, but resolving it, at least we're aware of it now. And the idea of this is to raise that awareness of the risk of bad metrics as well as the benefits of good metrics.
One of the things that brings to mind, I've been reading Eric Hollnagel lately, who's a safety expert, and he's got this amazing quote, which is something on the order of efficiency thoroughness trade-offs are found at all levels of all organizations. And I think that the reason I bring that up is I think, Phil, that your work enables a way to think about where do we make that trade-off, right? Where do we get efficient, pick bad metrics because they're good enough, and where do we get thorough because the thoroughness will actually have an effect on the outcome. And I think one of the things that I hope people are taking away from this whole series is, okay, Phil did this work, and it allows me to say, if I focus more of my attention over here, I'm going to get further faster without doing all of that work on the thoroughness side. I love Audrey's point about the wrong metrics. And I think that people pick bad metrics because they're available and they let you move along to the next thing, whether or not they work.
Yeah.
Sorry,
and they're
ahead.
easy. I call them lazy metrics because they're easy to gather, they're easy to understand, they're easy to tell a senior in the elevator pitch, they're easy to put on a diagram. Number of reports shared is an easy thing to measure and show people, look, we've doubled our number of reports. The fact that the reports are rubbish or the fact they've had no impact, well, okay, so what? But measuring the longer term impact of that one key report that went to 2 or 3 people that changed systems for the better, the kind of things that you're doing through your other models in CyberGreen that show those long term impacts of small changes, maybe those, share that information to a few key ISPs, and 6 months later, you've reduced your vulnerability, you've reduced your attack surface, but you have to wait 6 months to show that. You have to see the graph descending. So, it's possible. We're just not very good at doing it at the moment, I would say.
Yeah, and that's constantly, Phil, remember we were at the CCB conference in, I think it was Geneva, and having a discussion with the development bank who's doing all that international development of the cyber capacity building. And they said, given that funding that they're providing, how much would they spend more to actually measure the metrics? How much percentage of their efforts and funding is going just to measure that metrics part? And that's a realistic limitation and problems. And then, of course, the timing as well. Most of those impact we have to see short term, and also, you said, the long. So, but it's again, it's very, very, very fascinating study, Phil. Congratulations, and thank you for sharing that. Jess, thank you for your comment on the chat.
Sorry, I'm not on the chat.
Yeah. So it's about your slide. This session is recorded, and then it's going to be on our YouTube channel of the Cyber Public Health Workshop Series. So you can always check on that recording. Phil, would it be possible to share your slide to the audience?
I'll have to reduce them a bit, but yeah, I can certainly share them, or the key slides I can send through.
Okay, fantastic. Any other last comments or questions from?
Actually, I'm just going to ask Jess, maybe if you want to provide an email address to fill in like a direct message within Zoom. That way we reduce the number of steps and opportunities to lose things.
A good way of doing things. It's not a metric.
I have become a huge fan lately of let's reduce the number of loops in what we're doing.
Yes.
Sounds good. So Phil, what's after this? What's next for you?
I've got to write up.
I've
got to write all this up, and I'm struggling through that at the moment. And then, after that, I'm a free agent as of September. The PhD finishes then, and then back to gainful employment, whatever that is.
If you need somebody to review who is not from your background, because obviously I'm just in the law school at Essex, at the University of Essex. To send it by email.
That's very kind of you. Thank you.
It's all right. I hope you're publishing it. I mean, I think this is extremely, extremely valuable.
Yeah, I am. And Jess, I didn't realize you were UK government. So just so you know, I work with the Cabinet Office and FCDO on their impact and evaluation work. So, but yeah, thank you very much for the feedback, Audrey. That's really kind. It will be published when I have written it up.
Yeah,
so don't hold your breath, but it will be out soon. And there's a bunch of papers coming out hopefully as well. One is a systematic literature review of all the evidence around different types of interventions. So that's part of the PhD, but it's going to be a separate paper as well.
Thank you.
All right. Well, thank you again, Phil. This was awesome. And thank you all for joining. And we are, as always, looking for more speakers for future events. So if you know of anything, please drop Yuri and Arastu or myself an email, and we'll look forward to seeing you all next month.
Great. Thank you very much for your time. Thanks for letting me share.
Thank you.